I'm Kaye Coker. I'm a psychotherapist here in Atlanta, and I'm co-director of an organization, a nonprofit organization called Veterans Heart Georgia. We're about 3 years old, and our mission is to heal the suffering caused by the effects of war. And we work with veterans and their families and our communities in this effort to heal the effects of war. Very simply that. We're not calling it pathology and disorder. We are saying that this is a very natural outcome of the fact that people have been in war and have changed, and have been changed by what happens in the war theater, whether there's combat or simply being in the military, because all of these circumstances have quite an effect on what happens to an individual. And what has unfolded in our work over the past 3 years is an awareness of what happens in families and in children of veterans of war. This has been, even up till yesterday, when we heard the story of a woman who is the daughter of a French general who fought in World War II, who talked about the pain that her family suffered with the trauma of his experience when, after fighting a horrendous war after World War II in Algeria, de Gaulle said, "Oh, never mind, I'm going to give them their freedom. We don't need Algeria any longer." And everything that he had fought for and stood for over those years just collapsed, and his betrayal caused him to turn inward on himself, to become very depressed, to drink heavily, to isolate. His anger was felt in the family. And she spoke of the shame of not being able to bring her friends home, because she never knew whether or not he would be drunk in the afternoons and would be horribly embarrassing and scary to others. And also, side by side with the pride that she felt, because this man was a hero, and especially during World War II. So the conflicts that can be a result of military service and combat and just being in war, the effects of this in families can be overwhelming. I'm not sure that we can right now say that the war trauma is genetically transferred. I'm not sure that there is a lot of hard evidence. It certainly makes sense, but I think that a lot more research needs to be done at this point. What I do understand is that the relationships within the family system are definitely impacted. And this can be different for each child in the family. It can be different in terms of the way that the parents respond and react and cope with the trauma that the soldier brings home. For instance, what happens with a mother who is trying to reach out to her husband as he isolates and doesn't share his pain because he has no words for it, or because he feels stigmatized and ashamed of being weak. What happens in the way that she attaches with her children, this profound, incredible relationship that happens between parent and child. What happens with the first child, what happens with the second and the other children, and then what happens within the family and all of the relationships and the roles that the different family members carry out. Substance abuse, of course, has a huge impact. So we are investigating and exploring the effects of war in the children of veterans. We're working with the community counseling program at Mercer University to begin a study of, number one, the prevalence of these particular configurations of suffering. And that means we want to know how many families are impacted by war. We're going to begin with some focus groups and interviews as pilot study information, and then apply for a grant to study further. And the goal of the study is not just to count the numbers of people involved, but to determine how to intervene, how to make things better, how to make things different for veterans and their families. Because we know that the current generation of veterans has suffered, is suffering, and the impact on the children in these families is something that definitely needs the attention of our nation. There's so much emphasis on treating the veteran, which is absolutely crucial and necessary. But the programs to work with spouses and parents and siblings and extended family and children of veterans are sparse. And this is a gap that we at Veterans Heart Georgia are working to close, because we are seeing in our adult children of veterans the impact of war in their lives. This is very, very crucial, because we can see things like depression and anxiety, substance abuse, bipolar disorder, and all of the other kinds of, I guess I would say, adjustments and coping mechanisms that might kind of fly under the radar and not be detected, certainly not meeting the threshold of disorder, but it is disordered, not in terms of pathology, but in terms of order. And what we want to do is, number one, to help therapists to ask the questions of someone who might be a new client coming into the office with depression, anxiety, or whatever. Ask simply, who in your family has been to war, and see what unfolds. Just use this information in treating the clients that we see holistically, including the entire system, all of the factors in the history of the family that impact this person who's sitting in front of us. So therapist training is part of our mission, as well as our educational programs that we're developing for spouses and families of people who are coming back now. And that also includes people who have physically come back from other wars and may not be all the way home at this point in their lives and in the lives of their families. So there are a number of ways to raise awareness in the community, which is another aspect of what needs to happen, because our communities need to heal. Currently, it's very interesting how easy it is to turn away from the pains of war, to be much more interested in reality TV shows than what is really happening in Afghanistan to our military personnel, and what happens when they come home on leave, and what happens when they come home for a year and then go back for yet another deployment. And these are just the invisible wounds of war that I'm talking about. The other wounds to the physical integrity of the body, which are also extremely traumatic, is yet another layer in this unfolding of suffering of our families and in our communities.